My name is Singmayum nihad. I'm a third-year physiotherapy student studying at SGVU University.
I am Sanghmitra maurya, BPT 4th year student, SGVU University.
These are model presented here under the guidance of the Dr. Aprajeeta chauhan. And the name of the model being displayed here. HBO2 chamber. It means hyperbaric oxygen therapy. And we are going to demonstrate how it used and when to use, when not to use, and its type. And first we have to know what is hyperbaric oxygen chamber. And under this chamber we use the oxygen therapy. We have done the oxygen therapy. And it is a type of treatment to speed up the healing process which is caused by any infection. For example, if our tissue is injured, it needs more oxygen for the healing process. If we didn't give the adequate amount of oxygen, then swelling, pain, tenderness will be started. If we had given an adequate amount of oxygen to an individual, means the number of cells mainly RBC, WBC. And the first mechanism there is neutrophils to kill the microorganisms that enter our body. It will be increases, and the ability to kill the microorganisms will be increases, and the bacteria will start killing. And here we are presenting the monoplace. This is only for the one person.
First, before sending the patient to this HBO2 chamber, first we have to assess the patient if he meets the requirement to receive the treatment. So we will take the first vital signs of the patient if he have proper body requirement. So we will take the temperature, heart rate, respiratory rate. We will take the assessment of the patient to see if the patient meets the requirement to receive the patient treatment. So we will take the vital signs of the patient and auscultation of the patient to see if the cardiopulmonary situation of the patient is good. If it is not good, there will be risk of the some side effects and risk if the patient receives the treatment in not good condition.
And before the patient enters the chamber, we have to check the vital signs, blood pressure, sugar level. And after monitoring, you have to on the switch here, and this machine will be displayed here, like hemoglobin and hyperbaric oxygen level will be displayed here. And we use this therapy to those patients who have a severe anemia, brain abscess, there is pus formation, and arterial gas embolism, radiation injury, crash injury, and to the diabetic patient who had taken long time for the healing process. And we should not use to those patients who have a pneumothorax problem, as it can cause lungs collapse. And we use this therapy to the CP patient while the baby is giving birth. Due to the lack of oxygen, they are suffering from the cerebral palsy, which means it affects the one part of the brain, and it won't be able to reach the oxygen and blood circulation. For that, we keep the baby inside this chamber.
There are certain risks if the patient is receiving the treatment. That is, the normal air pressure outside is normal, and inside the SGVU chamber there is 2 times air pressure inside. So there are risk of the lung collapse. So we will have to prevent the lung collapse, we will have to take the proper procedure of the patient.
And in order to avoid the oxygen toxicity, we have to monitor it again and again. And at the starting 15 to 20 minutes, the patient will feel warm and they will fall asleep for after 20 minutes. And its uniqueness is that people are going to the Andaman and Nicobar Island Pondicherry for scuba diving. They use oxygen because it's below the earth surface, and while they return back, they are suffering from the high pressure and low blood pressure. For that, we use this therapy. Thank you.